Hello, my name is Wendy Love Edge, and I'd like to welcome you to the Bulldozer Health Show. In this episode, we'll be discussing Lyme disease, which has reached epidemic proportions, and I have with me in the studio Allery Bowerman, Lyme disease advocate. Welcome, Allery.
Thanks, Wendy, for having me.
I'm so glad you're here. So, Allery, tell me, how did you become a Lyme disease advocate?
Well, my three daughters got Lyme disease in May. They were on an overnight slumber party for Girl Scouts in the troop leader's front yard. And it was about a 27-hour period of time, and came back covered in ticks and got Lyme disease. So that's kind of where we get started.
Right. And how did you know that that's what they had?
We've actually had experience with it in the past. When my 7-year-old was 2, she had gotten a tick bite, her first that we knew of, and had developed a rash. I took her in, and I had actually been in a relationship with someone that had chronic Lyme disease, so I had already known a little bit about it symptom-wise, and she was having some flu-like symptoms. She had a bullseye rash, and that was kind of where we got started. At the time, the pediatric clinic doctor at the time had told us that it was impetigo, which is just a fungal infection,
right.
And to not worry about it, to go on home. And he'd given us an antibiotic, but it was like it wasn't good for tick-borne illnesses. But so about 5 to 7 days later, she had 105 temp, and we ended up in the ER.
Oh my goodness.
And spent 5 days in the hospital for tick fever, which is it's kind of a catch-all. Instead of actually telling you what they have, they'll give you this like broad diagnosis of tick fever. But if you actually Google that, it's really more of a symptom than it is a diagnosis.
Okay. So the hospital told you that they had tick fever, but you had experience with Lyme.
Right.
And so did you suggest to them that perhaps it was Lyme?
Not at that time, because they had run a test and she did have ehrlichiosis, which is another tick-borne illness that's pretty serious. So we kind of just, at that time, just went with that. And she seemed better. I mean, she had the IVs, and it took about 3 days for her fever to come down. And then you go home with another script and finish that out. And so she seemed okay. And it would be 6 months later, you get into spring and you get it again, or maybe 9 months. The following spring, she got bit again.
Oh, I see. So she was treated for a tick-borne illness.
Correct.
And seemed to get a little bit better.
Yep.
And then she was bitten again.
Right.
And had another rash, or?
I don't remember that one very well. I went back and looked at the medical records, and that's the only way I was like, oh, yeah, I guess we had another one here. And she had her doxycycline at that point, so she would have been about 3. And
doxycycline is an antibiotic. It's pretty heavy.
It is the best one for like a broad spectrum, and it does cover Lyme. You can use amoxicillin, but doxycycline covers like Rocky Mountain spotted fever, all these tick-borne illnesses, not just Lyme. So it's a good catch-all, but they're hesitant, and it's kind of frustrating because they have this. They'll tell you up front, oh, if you're under 8, it'll cause teeth staining. The CDC actually, I think it was last year or 2 years ago, came out and said not one case has ever been proven to cause teeth staining with doxycycline in anybody. Any age. And so
they were concerned about teeth staining,
right,
but not curing this illness.
Right.
That is very serious.
Exactly.
Right.
And for Rocky Mountain spotted fever, it doesn't matter what age you are, they give you that right up front. So it just seems silly.
Right. What do you think the hesitation is here in Arkansas to diagnose Lyme in children, or in anyone, really?
I think it has a lot to do with the CDC. I think it has a lot to do with the Arkansas State Department or Department of Health. They have a lot in there about, they're the hesitant ones. And I don't know, I think infectious disease is somehow involved, but it kind of is like a trickle-down thing where so we start with May, and when Emery, my 7-year-old, had gotten another tick. She had 14 on her.
There are a lot of ticks in Arkansas.
There's a lot of ticks, and there's
yes.
a lot this year especially. And so, we had 2 daughters come home with immediate symptoms. I mean, the very next morning, they had fever, vomiting, complete like lethargy, just dragging around. And So we took him into a walk-in clinic, and the walk-in clinic healthcare practitioner, she actually, by their symptoms alone, she had seen a target mark behind the 7-year-old's ear, and the other one had the very, it's not a well-known Lyme disease rash, but it is what we call a erythema migrans rash, and it is, it's going to look like little pustules.
Okay.
So
right, the target rash is more typical.
Right, that's the one that most people are looking for. In our experience with this time, only 10% of people actually get that one.
Okay.
So it's you're going to see it more often, just to be a very plain red mark, solid.
Okay.
With Emery, it was purple and red like a bruise.
Okay.
And we didn't know that even existed, but it didn't hurt, but it looked like you had just dropped something, terribly heavy on your foot.
So they've had all these symptoms, and
Right.
I actually met you on social media. I
Yeah.
noticed that you were trying to have the Department of Health here in Arkansas actually
Yes.
count them as cases of Lyme disease.
Correct.
But that's been an issue.
This is a huge issue here, and I don't know if a lot of people even think about it. I get that question a lot. What is the big deal about Lyme disease here? I have a couple theories. It comes down to for whatever reason, the Arkansas Department of Health does not want to admit that we have it here. And one of my theories is that they've spoken a lot about a brand new tick-borne illness in Arkansas. So they've put a lot of grant money, they've sent some researchers out, and they actually sent them out to places that we had gotten bitten. So they're going out to find, and they're doing drags for gathering ticks and testing them. And we'd spoken with them, what have you found? They're not looking for Lyme disease. They're looking for this specific.
It's very interesting.
It is, but you see, like Michigan has a new one. You have there's a bourbon virus in Kansas that came out. You have the Heartland virus in Nebraska or Midwest. So each state is getting this, I think they're getting money funded for announcing that they have this, new.
A different tick-borne illness.
I think it's all Lyme disease. And so if we come out and say, oh, we have Lyme disease, everybody, well, that just kicks all that they were trying
funding.
to. Yes.
A lot of things come down to funding and greed,
yes,
really.
and monetary.
But,
yes.
Really, as an advocate and having children with
right.
the disease, you just want them to get better.
Right. We felt like we stepped into something inadvertently that we did not really care about. We wanted our children to get well, and they, we'd gone in and they had to have that clinical diagnosis. In other states, just a bullseye rash is enough to start treatment immediately and get a Lyme disease diagnosis. So
right. And so with the treatment with the antibiotics, if it were Lyme, is your insurance covering the treatment, or the physicians who can help?
They would have had they been able to be treated in state. So because there's no specialists in this state.
There's no Lyme disease specialist.
None.
Because there's not supposed to be Lyme
exactly.
disease. Right.
Exactly.
Okay.
And they'll refer you to Arkansas Children's, they'll refer you to infectious disease, and you'll go there, and that is the big problem. Infectious disease in Arkansas Children's actually had called our pediatric clinic to tell us, oh, those aren't positive, those are false positive.
Oh my goodness.
And
that's very frustrating.
It is.
Because you just want your children to get better.
Right, and we're very fortunate that we actually have clearly positive tests that are, they're really not something that anyone should argue with, but the Department of Health is arguing. They want them to be retested.
Retested, even though the tests are positive.
The tests are completely great.
Well, Ellery, I want to add to our conversation Andrea Chevalier. She is also a Lyme advocate from Massachusetts with some experiences with her children. So welcome to the show, Andrea.
Thank you for having me.
I'm so glad you're here, and we want to hear your story too. So Andrea, what happened with you and your daughter?
Well, my daughter, it was a little different. We didn't see a tick bite. She didn't have a rash. She got sick November 2014. She started falling down, dizzy. She was pretty bad. We brought her to Boston Children's Hospital. She was there for 3 days. They never did a blood test.
So your daughter was in the hospital at Boston Children's, and they didn't do any blood tests?
No, They didn't do any blood tests. They did an MRI, and they basically said that it was conversion disorder, that it was stress and anxiety causing her to fall all the time, and to bring her to a psychiatrist and bring her to a counselor. And we did that, and they, thank God we fell into the right hands. They thought it was medical. So to make a long story short, we ended up getting a number to an LLMD, and we got her in with an LLMD, and they did all these tests, and they found out that she has Babesia, Bartonella, Lyme, and because of that, because it sat so dormant for so long, she now has other conditions. It causes autoimmune problems.
So she's suffering from heart problems, encephalopathy, and she's in pain as well?
Constant 24-hour headaches never end. Since November, they've never stopped. And mainstream doctors think we do have a good doctor now, who listens and he's open-minded, but a lot of the doctors didn't want to listen, because once you get that psychological diagnosis, they want to push the meds on you. And thank God, like I said, we found a good therapist, good psychiatrist. They weren't about doing that. Um,
And when you and I first were introduced, you were also telling me that they had accused you of having a disease called Munchausen's by proxy,
yes,
right? Which is a very rare disorder.
it is. Yes, and thank goodness for her therapist and the psychiatrist for that too, because they knew right away that I obviously didn't have it, but DSS had gotten involved because my daughter was sick and I was bringing her to the doctors, and I knew as a mom in my gut that something was wrong, that this was not psychological. So I was bringing her from doctor to doctor, just trying to find any help I could.
Right.
And someone suggested Lyme at the beginning, and I was like, this isn't Lyme. Lyme doesn't do this.
Right. Right,
My son
because
and my
many people are not educated about Lyme. I didn't know all of the things that can happen for chronic Lyme.
Oh, yeah.
And so, and like you said, if you don't have a physician who's a specialist who's well versed in the disease, they might not know either, you know.
Exactly.
But I bet that they accused you of doctor shopping because
Yep.
you were out trying to find a specialist and any professional who
Right.
could, physician who could help you. This
Then
is
that's
a
what it
huge
was.
problem in our system. We don't
Yeah.
really have medical freedom. And I'm sorry that that happened. So where are you at this point in her health and in the process?
At this point, we're definitely in a better place. The Munchausen, in that way, they said I was trying to get attention. That's no longer.
Oh,
They
thank
closed
goodness.
that.
Mhm.
She has an amazing Lyme literate doctor. She has a neurologist. She goes to physical therapy. So she is slowly getting out of the wheelchair. She's standing now. She does still have to take the antibiotics. She's on 4 different antibiotics. We're trying to get the pseudotumor cerebri under control so she can go back on treatment, so her nerves can be treated with the IVIG treatments.
So she is receiving treatment, and I have 2 questions about that. One, is this treatment and seeing these Lyme literate doctors, is that covered by your insurance?
No, we have to pay out of pocket. We've done a couple benefits to be able to afford it. It is astronomical. We've paid,
Yeah.
I can't even tell you how much. I'd have to, if I had to guess, I'd say about 40,000.
Oh
That
my
doesn't-
goodness. And you know, we're all required, Allery, you probably can chime in on this too. We're all required to pay for health insurance.
Yep.
Right? And yet, when you are in need, like you are and like Allery is, it's not covered. How can
No.
that be?
Well, a lot of times it's a good thing, because otherwise the insurance companies are controlling things, and if they see too many tests that are run for Lyme disease, or too many tests that are run, or too many drugs or diagnosis, they will target a physician, and they will actually kick them out of practice. They will
my
put so
goodness.
much pressure on it, and it's happened. I've seen it happen here, and so. That's why the clinic here was so, if it would have been just one child that tested positive, they could have just given her treatment and everything would have been fine. But the fact that we had 2 come back positive, and all you need is 2 to change the county to be endemic, which means you have this big announcement, hey, we have Lyme disease in Arkansas. So that's why you have to pay out of pocket, and they don't want to mess with insurance companies because it's easier.
It just doesn't make any sense. You know, what's driving the system is the money,
It's money.
rather than caring
Oh, yeah.
for,
Yep.
in this case, our children. And so I'm so sorry that that's happening for both of you, but I think it's really exciting that you're both advocating for your children and you're willing to put your story out there and talk about it so people are aware.
I think it's important that people understand that there's so many things that that Lyme disease masks the same, and they think they have this, and they go to this doctor thinking they have Parkinson's or MS or ALS, and they don't ever get better.
Right.
So if you actually look at the big picture, and what if all that is just Lyme disease,
Right.
and they're covering all this up? Well, they're making a ton of money on our sick people.
Right, which is true for a number of diseases,
Yes.
but in this case,
Right.
very, very difficult and sad. So my other question for you is, what is the prognosis for your daughter? You know, if they had caught this in time, would she have been in the situation she's in now? And what is the prognosis?
If they would have caught it in time, that's the thing. If they can catch it right away and administer the right amount of antibiotics right away, you can catch it and you won't have chronic Lyme. There's still a small percent that will have the chronic Lyme. But if you catch it soon enough and fast enough and recognize it right away, you have a window of opportunity to stop this from happening. But when you ignore it, the damage is done. And
Right.
the problem is Lyme goes into your brain, bones, your muscles. You can treat it.
It affects every system, really.
Right.
Yes.
Yeah.
And even after many years of antibiotics, you still get every little tiny bit of it. It's horrible. It affects everything and every aspect of her body. So she will have lingering, even if they treat her, she will get better, but she's always going to have lingering problems. A lot of the problems that happen, like the autoimmune, I don't know if that's ever going to go away.
Right.
And that's the problem. You just
Right.
don't know. You don't know what you're left with.
I'm so sorry. So, Allery, for your children, what is the prognosis?
We will have them. They've had 1 month of antibiotic treatment. We have 3 more to go before we kind of reevaluate. We saw last year. We saw my 7-year-old start to have a personality change. She went from being an extrovert to being an introvert. She took minutes to talk versus like that. We actually weren't sure what was going on with her, and we thought it was just, oh, she's in 1st grade and she's just having a lot of anxiety. She never had anxiety before. So now that we're having her being treated, that's all gone, and our kid's back. And it just, we're tick-borne illness aware people. We're Lyme aware people. We didn't even see those symptoms and connect it to
Right.
tick bites. My oldest child, she's a brilliant artist just naturally. She has hand tremors that
my
if
goodness.
they had treated her here, and that was the only child that they, they treated the youngest one, but they refused when my oldest one was tested a week later. They said, no, we can't help you. And so we had to get into a specialist. It took an extra month and a half. During that time, she developed these hand tremors, so she actually got sicker.
Right, because the longer you wait to
Yes.
treat it,
So-
which is what you experienced also.
Right.
Right. And I was reading all about Lyme disease this week, and I noticed that the statistics show that it's more prevalent than breast cancer, more prevalent than
HIV.
than HIV.
Yep.
Absolutely.
And it's really important for people to understand that, and to understand that it's not just a Northeast problem. We're talking
No.
to you from Massachusetts, Andrea, but here we are in Arkansas in the South, and we know that it exists here.
Right.
Even if people want to show a
Right.
blind eye, the people in charge, let's
Right.
say. And it exists on the West Coast too. I was reading there are different types of ticks that are carrying it,
Right.
but it's also prevalent there.
There was a study done where they had a bunch of clean ticks that had nothing in them feed on some mice that had Lyme. They then tested the ticks and they had Lyme disease. They
Oh my
tested the
goodness.
ticks babies, they had Lyme disease. So here is the big broad problem. If a mosquito or a tick feeds on your child or my child, they now have it. Then they go and they spread it, all corners.
Right.
You have it, you don't know it, you have a child, you just passed it on. So these
Right,
are
I
huge
did read
problems.
that as well.
Yes,
A pregnant mother
breast
can
milk
pass it
and
on.
in utero.
So
We're
this-
questioning now too about my kids if it came from
Right.
utero, because my son was diagnosed at the age of 6, and we went back in his records and realized at the age of 3 he had a past infection, and his records were showing that his white blood cells were down and his red blood cells were down, which when your white blood cells are down usually means you've had an infection for a long time.
Right.
So we're questioning. My husband's had Lyme. 3 out of the 4 of us have had Lyme. I've never been tested. So at the end of this month, I'm getting tested myself.
And even if you are tested, there's that 2-tier testing system which kicks
tests
out
are accurate.
70% of people that are tested that may have it, but you might not make it through that first tier. And they don't tell you this. You just go in and say, I would like a Lyme test, and they say, sure. And you might get it just a flat negative. If you don't have what they call a Western blot, which is the second step, you will not know which bands are showing up positive. That means which antibodies you're making that are for actual Lyme disease specific bacteria.
So if someone suspects Lyme disease, what should they ask for at the doctor?
You should still try to do the 2-tier because that's the only thing that the CDC is recognizing. At least in Arkansas, we need more people to come forward that have CDC positive testing. Does not mean that the other people that have other testing aren't positive. It doesn't mean that if you have a negative, you're not positive. That is the frustration.
Right.
But we want more people to get those 2-tier. Put emphasis on, even if the first is negative, please go ahead and run a Western blot on me. That way you know that they have permission to go ahead and kick it into the second step, even if the first one doesn't show up.
Okay. And is that your experience also in Massachusetts, the same type of testing?
Yes, and the best testing out there, it costs a lot of money, but IGeneX testing, it's sent out to California. Very, very, very good testing, but it is expensive. Another test you will have to pay out of pocket.
And it's not recognized as far as FDA or
Exactly.
CDC. So
Well,
if you're going
listen,
up
listen,
arguing,
so
then yeah.
Listen, the FDA approves things that then years later they rescind and say that's not good for you, we're going to take it off the market.
Believe me.
So I don't have any faith in the FDA personally, but yeah, that's really, really a difficult
But if you want to find out
situation,
if you're
and-
positive and you want a more specific, the IGeneX is a great
IGeneX,
test.
okay.
iSpot is another one that a lot of people don't know about. And there's one molecular DNA. Have you seen those?
I've heard of the new there's a urine one that's supposed to be really good too.
There's another one. And these are, of course, none of them are
covered by
Right.
insurance, and you have to find
And
someone who will
CDC
do
don't
that.
right. And
recognize
for
that.
our purposes, trying to get, we want more cases, because when I talked to the Department of Health, that was their big thing was, we have 2 positive cases to make this county endemic, which the reason that's important is that once we have Benton County endemic, every person that gets a tick bite, then those physicians have to consider Lyme disease as an option now. They have to
Yes.
actually consider it in a diagnosis, whereas right now they're just going, oh, that doesn't exist here. Next.
Yep.
So, Andrea, I know that you and your husband started a support group, TikTok support group in Massachusetts, correct?
Yep.
How can people reach that support group if they're looking for information or assistance with Lyme disease?
We can be reached on Facebook. It's TikTok Lyme Support Group of Munson. We can also be reached online. If you Google us, we'll come up. Our phone numbers are on there, and anybody can call anytime. We have
Wonderful.
the last Saturday of the month. So anybody is welcome. Family, friends, power. Knowledge is power.
Great. Thank you so much for all that you're doing, and we wish
Thank
your
you.
family and your daughter the very best. We'll have her in mind
Thank you.
And Allery, in Arkansas, is there somewhere that people could connect with you?
Yes, you are more than welcome to reach me on my Facebook, just Allery Bowerman. And yeah, I've been helping people and talking to people, especially in Northwest Arkansas. If we don't have what you need here, I have other people that I can connect you with.
Great.
If you are interested in joining a cause to help Arkansas to actually start to admit that yes, we do have Lyme disease. These borders are not, a great force field that kicks out all Lyme disease here. There aren't special lizards. No joke, we hear this. There's not special lizards that that ticks feed on that turn them into no Lyme disease ticks.
There's not some.
We have special feeding patterns, is what our ticks have here. I said they're probably vegan. I mean, just in Arkansas.
Well, that would be nice.
Right? Just in
if
Arkansas.
ticks were vegan,
exactly.
we wouldn't be having
we
this
wouldn't have
conversation.
exactly. This would be
Right.
it's all be taken care of. So we have a group called Arkansas Bites Back, BYTES. You can find that also on Facebook. So
Okay,
if you're ready to
wonderful.
join us and are trying to get to, we could use numbers too. So we just want to spread awareness and make sure that people know, yes, it is here. If you get a tick bite, do not discount it. Start to familiarize yourself with what the symptoms are so that you can make sure that you are an advocate for yourself or your family.
Right. And we wish your family the
Thank
very
you.
best also.
Thank you.
Thank you so much for joining me, both of you.
Appreciate it.
Thank you.
Bulldozer Health Incorporated is a 501c3 nonprofit organization and healthcare reform initiative. You can find us at bulldozerhealth.org. Take back your health, America.